Hi there, my name is Ashleigh Schopen and I'm a certified child life specialist. This is a profession that many of you probably have never heard of before. Your friends, your families, your parents are probably not familiar with this profession, which is why I really wanted to share it with you on this platform. Child life specialists provide the psychosocial or the social emotional care to patients and families in the healthcare setting or other settings to help reduce stress and anxiety and prevent potentially traumatic experiences. That's a bit of a mouthful, so let's take a peek at this video to learn just a little bit more.
Child life specialist helps patients and families to cope with being in the hospital. We help to reduce the trauma that happens here during medical experiences. Overall, we just help to make it easier on families and patients while they're here in the hospital.
Here at CHOP, we're one of the largest child life programs in the country with just over 75. You can pretty much find a child life specialist anywhere that you would go, especially at our main campus, from the emergency department to every inpatient unit. I personally cover outpatient clinics in the Burger Center, and we even have some that are covering our satellite locations.
The type of schooling that you need to become a child life specialist is a minimum of an undergraduate degree with a child life internship. Some of us have master's degrees as well.
As child life specialists, we help to support both patients and their families for hospital procedures. And we do this by helping a child to understand what's happening to them and around them in a way that they should understand. So if I'm meeting with a 3-year-old, I'm going to talk with language that a 3-year-old should understand. A 10-year-old, a little bit higher level. We also help to develop coping plans. So we figure out how can we make this as easy as possible for you at the hospital and walk away with a smile.
So working in the NICU, procedural support looks a little bit different. I actually work with the infants during even the simplest procedure, like changing a diaper. I may be providing some facilitated tucking, like tucking their arms and legs into their body to help to support them, to help keep them calm during those things. For children here at the hospital, they may come into the hospital not having any sort of medical experience previous to this visit. So if they know what's going to be happening, it makes that visit easier for them.
Research studies show that anticipatory stress is far better than unexpected stress. And so we know if we provide kids with developmentally appropriate education before an experience, not only are they going to be far more compliant with their medical care, but they're also going to have a much greater level of trust among their caregivers while they're here, and that is absolutely critical for children.
As child life specialists, we really look at our role as people who help the entire family cope, so not just the patient, and that many times includes brothers and sisters as well.
We're going to help to normalize the hospital experience for them. So that may be taking them down to the studio to play bingo, doing a project with just them and not the patient, because that gives them that special one-on-one time that they need.
When we think about helping to prepare kids transitioning to home or to school, we approach it in very similar ways as we might prepping them for procedures and for the hospital experience.
Their family and friends may be asking questions about why they're in the hospital. So we help to prepare them to answer those questions. So we may do some role play with them to get them thinking about questions that people in the community may ask them.
We really try to not just focus on what happens here at the hospital, but how are they going to transition into life and still be normal kids with these new treatment or medicine that they have to take after they leave the hospital. A lot of times the medical team will say that they feel like child life comes in with their magical wand and is able to wave it, and then the child is able to cope well with the procedure. And it's not that we have a magical wand, but we really just use simple, honest information to explain to the child what to expect in a way they should understand, and then help to give them tools to make the experience easier for them.
There truly is a theoretical foundation for everything that we do.
You may see us playing, you may see us laughing and being silly, but we are a vital part of your child's care team by helping them to cope with being here at the hospital, by teaching them why they're here and preparing them for anything that they're going to be going through, while we also are supporting you as the family.
So there's a lot to unpack there. Child life specialists can be found in a variety of different settings, including inpatient children's hospital. In other outpatient areas, child life specialists can be found in adult hospitals in supporting kids whose parents are receiving treatment or have died. We can be found in funeral homes, we can be found in dentist offices, we can be found in private practices, really anywhere where a child might be experiencing significant stress or trauma. hopefully you can find a child life specialist there. This is a little bit of a newer profession where we only became a certified body as of 1986, which was the year I was born. So hopefully that doesn't tell you too much, but it hasn't been very long at all, which is why this is a profession that not a lot of people know about, but is a very, very special profession. When you kind of summarize, what we do on a daily basis, that's what's so exciting about it, is because every day is so different. I don't have a typical day. I don't have a typical routine. I don't have a lot of areas that are super specialized because every treatment plan for every child and every family is very different. I specifically work in the pediatric intensive care unit, and I sort of specialize in trauma and end-of-life support, where I help families to navigate some really difficult situations. But for the purposes of this video, I'll kind of do a little bit more of an overview of some of the things that the majority of us do on a regular basis. We know kids really well, and we know what is most supportive to kids during really hard times. We try to normalize the experience as best as possible, which is a word that you heard in the video, and really trying to think about what is comforting, safe, familiar to children and young adults and adolescents of all ages. And so one of the things that we're really heavily focused on is play. Play is familiar, it's safe, it's comforting. We do a lot of different types of play. We might do regular distraction play. We might do therapeutic play. We might do something called medical play, where we might fill up the syringes with colorful water, and we might use them as special water squirters, and we get really excited and we have fun with all these things that are otherwise really scary to a lot of kids. We help to make it feel a little bit more fun, normal, more child-friendly. Some parts of our job are super fun. We get to celebrate birthdays. We get to celebrate holidays. We get to facilitate special visitor, like when celebrities come to visit the hospital. We get to help kids decorate the hallways. We get to help pump them up for a big football game. Like, there's so many different parts to our job that are super fun. And then there are a lot of parts to our job that are a little bit more clinical and a little bit more focused on truly reducing the stress and anxiety. We can help kids to have fun, but another really important piece to that is empowering these kids and helping these kids to truly cope with the hospitalization. And so what do I mean by that? We help to support them through ways of empowering them and helping them to be active participants in their healthcare experience. Because as you can imagine, or maybe you've had experiences of your own, where if someone's just coming at you and they're doing things at you and to you, that can be really scary and really upsetting, especially if you don't understand why they're doing or how they're doing it or what to expect. How is that going to feel? What's that going to look like? And so our job is to provide the psychosocial or the psychological preparation prior to new and different experiences. And so if there's a child that needs to, for example, have a poke with a needle, let's say they need to get a vaccination, like our flu shot, our job is to explain to them what it is that they need to have, why they need to have it, and exactly what to expect. So depending on their developmental age, we will break down the different steps to having that procedure done, so they're a lot less scared, they're a lot less nervous, and they don't have room for misconceptions. And so we're experts in child development and understanding and tailoring our treatment plan based on the age of the child. And so I might approach a 2-year-old very differently than I approach a 7-year-old, than I approach a 15-year-old for when they're getting their flu vaccine. And so we do a lot of education on experiences specific to the healthcare setting, but then also new diagnosis teaching. We might have a 12-year-old come in with a new brain tumor, which happens, and it's hard. And imagine them just kind of coming in and getting all these tests done and getting this treatment done and then just not really know what's going on around them. And so our job is to go in and say, do you understand why you're here? Do you understand what's going on? No? Okay, let's talk about it. Let's go through it. And we follow the patient along on their journey to ensure that they have the information that they want and that they need, that they feel comfortable and empowered to talk to the medical team, to understand everything. And so we kind of work with them, ideally from start to finish, to make sure that all of their psychosocial needs are being met. I could go on and on and on about all the different examples of all the different things that we can do to support patients. But if you think about it, if you kind of took a moment to pause and think about being in the hospital right now, or if you've had an experience before in the past, what was hard about that experience? And think to yourself, like, what could have been done to make that a little bit more manageable for you, right? Some people say we make the hospital better for kids, and better is not always the right word, but what can we do to make it feel a little bit more manageable? Is it helping you to celebrate a birthday? Is it helping you to provide distraction because you're nervous about a procedure that you have later today? You're hungry, you're nervous, you're scared, you're tired. So maybe it's just providing, getting lost in your favorite video game for a little bit. Or maybe it's someone coming to talk to you about the scanner and the pictures that we're taking, and that nothing is actually going to hurt you or touch you or be really surprising to you. So it's a really, really special profession. It's something that I love dearly. I've been working at CHOP now for the past 10 years, and I'm incredibly happy with what I get to do every day. It's an incredible privilege. Most people ask me, the most common question is, how do you become a child life specialist? Especially because it's something that not a lot of people are very familiar with. All sorts of child life specialists come from a huge variety of backgrounds. As long as you had that degree and you've taken a specific number of courses that fall within certain topics, then you're good. Those topics include child development, family systems, research, loss, courses taught by a certified child life specialist. And so once you've completed those courses and you've completed a 600-hour internship, then you're eligible to sit for the certification exam. Most hospitals throughout the nation require that you're certified within your first year of employment, so it gives you a little bit of a buffer there. This is a very competitive profession. There are lots of people who are passionate about working with children, passionate about working with special populations, and passionate about working in the healthcare system. So it is competitive. My greatest words of advice for you is to start volunteering as soon as you're able to. Volunteer with unique populations, volunteer with kids, volunteer in a hospital setting. A lot of hospitals, like the Children's Hospital of Philadelphia, requires that you're 18 or older in order to volunteer. Don't be discouraged by that. Continue to look around in your community, see what opportunities you might have to volunteer. When you are applying for internships, they will look as volunteer hours as a requirement. Some programs require that you volunteer before even coming into their internship program. So I would say that's the best thing that you can do to help set yourself up for success, especially at this age and this time right now. I also try to help people identify when kind of thinking about whether or not this is the type of profession for you. I meet a lot of people, a lot of young people who, come in with great enthusiasm saying, I really love working with kids. I really love working with kids. And I think that's incredibly important. We all really love working with kids, but I also like to remind people that you need to be just as good at working with parents and adults as you do working with kids. Kids and parents are a package deal. And so you can be really, really, really great at working with kids, but just know that I can't be successful in my day-to-day work without partnering with parents and being a good communicator with parents too. So that's something that I always like to kind of highlight. A lot of information for not a lot of time. If you have any other thoughts or you want to kind of dig around a little bit more in regards to the world of child life, visit childlife.org. It's a really great website that can be really overwhelming. It's got a lot of information, a lot of parts to it, but it's got all the information. It's got all the parts that should really help you out. And then also if you visit chop.edu and you search Child Life, you'll see our page there with our resources and kind of get a greater idea of what we do. I wish you the best of luck, and thank you so much for taking the time to watch this.